Research Methods in Personality Psychology, Part 1, General Issues. Professor Michael Botwin, Personality Psychology, Department of Psychology, California State University, Fresno.
Night, baby.
There's some general issues we need to talk about with the use of personality tests that actually generalize to the discussion of many other tests. So I want to talk about 3 issues with personality tests here. And they have to do with why you're bothering to give this test in the first place. Now, some tests are written to help define a theory. So, as you would imagine, Eysenk's personality questionnaire measures Eysenk's model of personality. The Big Five test measures the Big Five. That's pretty much face value. But is there a theory behind the test that needs to be verified or is useful for looking at some other issues? For example, Eysenk's basic dimensions, extroversion, neuroticism, and psychoticism, have been used to study many other phenomena from vocational choice to sexual practice to psychopathology. Now, the most widely used of all personality tests, at least it's got personality in the name of it, is the Minnesota Multifaceted Personality Inventory. And this is a test that's used for clinical purposes, and it has a massive number of keyed scales to measure all kinds of different psychopathologies, as well as a whole series of scales to make sure you aren't lying or faking or doing something else to distort the test results. Now, for better or worse, there is not a Minnesota theory of personality. The test was devised by psychologists at the University of Minnesota. The University of Minnesota owns the rights to the test, and they make a ton of money off of it, as you would imagine. Now, that test is a test that if you're going to be admitted to the University of Minnesota, you have to take for admissions. Is it because they only want people with no pathology as students at the University of Minnesota? No, that's how they build their normative set. But you may wonder about the efficacy about such issues. So why do we have the test? We have one notion, which is theory-driven. The second is purpose. Why are we giving this test? If you're attempting to uncover latent psychopathologies, then the MMPI is a good choice. If you were to look at the index of tests, it's called Burroughs Mental Measurements Yearbook, they have reviews of all published psychological tests. And some of those tests, for example, for vocational choice, we'll see if you have the dexterity to do certain jobs in certain vocations. They might assess your aptitude or ability to complete college or graduate study. When you also look at tests, you have to look at the population that provides the norm groups. So if you have a test that's normed on schizophrenics, is it useful to measure regular samples of individuals in the population who may not have schizophrenia? So we have to look at that. Many people have the problem that in our universities we have large numbers of students in intro psych, and they provide data for many validation studies of tests. So you have to wonder whether the validation studies of a college sample can be generalized to the population. Now, you need 2 things to make tests work. The first is reliability. I'm sure you've learned all about reliability in your earlier classes. Let me just remind you of a couple forms of reliability. We have measures of internal consistency. This can be as simple as a split half reliability, or as sophisticated as Cronbach's coefficient alpha, which is the average of all possible split half reliabilities. Incidentally, for you Fresno State students listening to this video lecture, Lee Cronbach, who spent most of his career at a little university you might have heard about up the street a bit, Stanford, was a Fresno State graduate earning masters in mathematics and psychology. The Cronbach family left a fund to give a student who studies measurement issues in psychology a $500 scholarship every year. It's called the Cronbach Scholarship. Might think about that one if you're interested in measurement issues. Second kind of test reliability, test retest reliability. I give you the test on one day, then I give it to you at a later time, and I see if the scores of the individuals I've given the test to highly correlate across the different admissions. And naturally you may use multiple times, not just one, but that's the most simple case. Inter-rater reliability. Do you have inter-rater reliability, meaning that if you have more than one individual rating a target participant, do they rate people in the same way? This is critically important. In my research group, when we do a field study, we sit down and go over the rating system with the people that are going to be working on the project. We calibrate on some samples and we make sure everybody is agreeing. So if one person says 4 for a characteristic, another person should also say 4 for the same thing. And you can train raters to do this. Now, reliability is important, but it's not sufficient in terms of understanding what's going on with psychological test. And you probably thought of this already as I'm talking, but the most important thing to talk about with a test is that test valid? Are you really assessing what you think you're measuring? If I give you a test of my favorite topic, extroversion, introversion, are you really measuring introversion, extroversion, or are you measuring sociability or gregariousness or talkativeness, which are all subcomponents of extroversion, but not necessarily the totality of the construct. So let's look at some major forms of validity. First of all, we have predictive validity, which is pretty much what it sounds like. Predictive validity in a test means that it predicts some possible future status for a person. Predict whether they'll do well on a job, whether they may be prone to do certain things based on their personality characteristics. So it predicts something. Now the GRE and the SAT are supposed to predict how well you do in graduate school or university in general. And they have a reasonable amount of validity, although a lot of that's been questioned recently, and some institutions are dropping GRE as an admission status and SAT as well. Does your test converge with other similar measures? There are very many measures of introversion, extroversion around there in the world of psychological testing. If I give a group of participants several measures of introversion, extroversion, I would anticipate that they would be highly correlated. If they're not, then I might be either looking at different aspects of the construct like extroversion, or I may just not have some really good tests. Now, discriminant validity is just the opposite of convergent validity. If I have two scales that measure two very different notions, they should not correlate. So, for example, Eysenck in his model of personality believes that neuroticism is a construct that is not related to extroversion. So if you were to correlate a neuroticism scale and an extroversion scale, you would find little to no correlation. You might find a little correlation there because of method variance using the same technique to collect the data, but if they're truly different constructs, they should discriminate against each other and not correlate. Face validity. If I look at an item, can I tell what scale it belongs to or what it's measuring? This goes for questions, can also go with scales. My favorite thing to pick on: introversion, extroversion. If I ask people on a 1 to 5 point scale, are you 1 very introverted, 5 very extroverted? And then I correlate that with a full-blown 30-40 item scale of extroversion. Generally, I'm going to get a 0.6, 0.7 correlation, a really good convergent correlation, because people can pick up a concept like introversion, extroversion. They understand it. The question's got a lot of face validity. Some questions have absolutely no face validity. So let me ask you a couple of these questions from different MMPI scales. I like blue. Yes or no? True or false? You don't have to answer the question. And notice the question doesn't say blue walls, blue shirts, blue jeans, blue suede shoes. It just says blue. Well, if I were to ask you what scale the item comes from, you might look for some face validity and say, well, blue is depressed, so it might belong to a depression scale. And you'd be wrong. Actually, schizophrenics endorse that item on the MMPI, and it has no face validity. I think my favorite item for having no face validity is this one. I like to fix screen doors. Sit there for a second and try to think of a scale that I like to fix screen doors would belong on. Kind of difficult. Maybe a manual dexterity scale, maybe a handyman scale. But in the instance that I've seen it, it actually measures psychological repression. Why repressed people like to fix screen doors, I have no idea. It has no face validity. It does, however, have criterion validity. Now let me use an old saying to explain criterion validity to you. You've probably heard the old saying, if it walks like a duck, quacks like a duck, must be a duck. That's kind of what criterion validity is in a nutshell. If I give a group of individuals a pool of test items, and maybe they belong to a certain group, maybe they have a certain occupation, a certain personality characteristic, a certain pathology, and I take all of the items that they endorse and turn them into a scale, I have a scale that has criterion validity, because you are fitting in with the criteria of the group that provided the normative data. Now let's say that you endorse the I like blue item. Does that mean you're schizophrenic? No. It simply means that you answered the scale like a schizophrenic would, and you need to go back and get a clinical psychologist to do further evaluation. These criterion validity scales are used for tons of different things. My favorite place to discuss them is in the context of career opportunities. You go in and you assess a group of individuals that have a certain occupation. If they score a certain way, and the participants then taking the test after you've created the scale score the same way, maybe you would like to have that occupation. Maybe that would be something that suits you as a career goal. Now, all of these forms of validity are subsumed by the most important kind of validity, which is construct validity. And construct validity is simply the notion of, are we accurately measuring what we conceptually believe we are measuring? It's easy with physical things like height, weight. You can get really good construct validity with those types of things. When you move into psychological constructs, it gets a lot fuzzier, requires a lot more work to make sure you're really measuring what you say you're measuring. And lack of construct validity has invalidated many studies, because people have found out that they thought they were measuring a construct and they were really measuring some other variable. So construct validity, the most important thing to talk about, vitally important for personality psychology. Then we have the notion of generalizability. Do our measures show validity across different groups, different contexts, different testing conditions? Is extroversion always extroversion? Is introversion always introversion? If I take a large group of students in a class and I give them an impromptu public speaking assignment, and many of them are nervous and have some anxiety about speaking, well, I've probably got a context that's evoking this condition, which may not be present in my scores for the individuals. There might show up as being far more skewed to the introverted side of the scale. So can we generalize these things? And it's important for personality psychologists to use measures that generalize. Is the person that we're looking at generally, I know this is using the term itself to define it, extroverted across different times, different events, things like that. The last issue I want to discuss with you in psychological testing and assessment is how tests may be biased. And I'm not necessarily talking about the test being biased themselves, although that has historically been a problem in the area of testing, especially in intelligence testing theory. The biases I'm talking about are the biases committed by the participants in our studies. One of the most long-standing biases in test data has been the notion of social desirability, first noted by Marlowe and Crown in the mid-1960s. And they found that some individuals, when completing a psychological test, did it with the intent not only to provide results, but in turn also to please the test giver. Now, this means individuals don't give accurate ratings about themselves. And that's a considerable problem in testing. So people have gone out of their way over the years to create tests that are free of social desirability, or to figure out some kind of way to ferret out the biases and remove them from the test results. Now, later, social desirability was construed by Marlowe and Crown as possibly a need for social approval, need for approval. And they speculated, and I agree with them on this, and other people have made this point as well, is that maybe social desirability is really a small personality trait. Some people are just pleasers and they want to please the test takers, or test administrators. Now, Del Paulis at the University of British Columbia has studied social desirability, and he breaks social desirability down into two subcomponents. The first is an active one, it's impression management. This is where an individual attempts to sway your impression of them in some way. And it could be good or it could be bad. Let's say that I'm going to be hiring people and I give them a personality test. And some of my personality questions say, I'm responsible, I'm honest, I'm punctual. And the respondent really isn't any of those things. Do you think they're going to be honest on the personality test? So some people try to sway how the person who's giving the test views them based on their results. And this is an active process where you're trying to manage the impression that you're providing the other individuals. Now, there are cases where individuals may do impression management for just the opposite. Rather than to make themselves look good to the assessor, they want to make themselves look bad. My ex-wife worked in the area of workers' compensation and rehabilitation when that was a thing you could do, a job you could get with insurance companies. And many of her clients, and this was in Michigan when the workers' comp laws were very different, were disabled on the job. They didn't have much of an education. Many of them had worked on the line for one of the auto companies, and they were making a lot of money for someone with high school or less education. They would get injured on the job, and to get them back to work and productive, the state of Michigan came up with what seems like a very reasonable law. They would take someone who was off of work due to an injury once they were healed, and if they could no longer return to their original job, they could seek out work for another company, and the state would subsidize the difference in salary between the former salary and the current salary. Well, as you can imagine, most of these individuals, and they were almost all men, didn't want to work at a minimum wage fast food job. Let me give you the context there. The state was paying them 80% of their salary on workers' comp without taxes. So you're sitting at home not having to work and getting 80% of your salary. And it does cost you something to work. So these guys were doing fairly well. So did they want to work in a fast food place for 40 hours a week at minimum wage to make up for virtually no salary by the time you start taking taxes out of things? No way. Just because these guys didn't have college educations didn't mean they weren't bright. So what many of them did is they would show up late. They'd be a no-show to the interview. They would ask ridiculous questions If you've ever seen the movie Step Brothers, when the two brothers go out on job interviews, it reminds me very much of what my ex-wife was dealing with on her former job as a rehab counselor. So some people want to make a bad impression. Now, Paul has also found that there was a other component of social desirability, and that's self-deceptive enhancement, where you think you're nicer or better than you really are, and you're really fooling yourself. This is a harder one to ferret out in the study, but Paul has done a good job of looking at this. I think of people who are kind of clueless. I think of especially the Steve Martin and Dan Aykroyd wild and crazy guy characters from the original Saturday Night Live series, who thought they were God's gift to American women, and they were really God's joke to American women because they were so goofy. So these kind of biases are really important, and test writers work hard to make sure that they don't show up in their data. Now, sometimes you get people who respond in an extreme way. You give them a 9-point scale and they only answer 1 and 9 for everything. That's a bit harder. Do they really have that extreme of scores on personality, or are they just faking out the questionnaire and trying to get it done as quickly as possible? That may happen. That one's a harder to get at one, so you can get at that on an individual basis by looking at score patterns. Some people might fake a test. They might just want to fake it. They might want to show themselves in a certain light. They might not want to answer the questions honestly. And then finally you get the issue of interpretation of the test items. Now, this is a big one. Are people reading the items as you intend them to be read? On Eysink's personality questionnaire, there is a lie scale. And I really love some of the items that are on the lie scale. So, for example, how about this item? I have never spoken badly about another person. Might be a slight paraphrase there. Can you honestly say that? Can anyone really say that? How about this one? I have never thought of taking something that did not belong to me. Think about that one. It doesn't mean you've stolen. It means you've never even thought of stealing something. Now imagine how many times you walk past something during the day and you can think, well, I can grab that. Who would really know that I took it? But most people are basically honest and they don't grab the thing. So these things are also prone for interpretation. Do you interpret it globally, specifically? So your questions have to be written in a way that prevents people from making their own interpretations on them. This is a problem I get with students who take my multiple choice test. They oftentimes add an interpretation to the item that's not there, but that's a whole different kind of testing. So watch out for that when you take the next mini exam. So, those are some general issues in testing. We'll come back and look at different sources of data in personality psychology. We'll see you next time. Bye. This has been a We Have Couches video production. Copyright 2020, Professor Michael Botwin, all rights reserved.